Hello everyone. I wish each and everyone to be safe at your place and doing fine in this COVID-19 pandemic time. I am Dr. Tapash Kumar Majumdar, Senior Consultant Dermatologist. Dermatologist in common terms can be said as skin specialist. We treat skin, hair and nail disorders. I have nearly 40 years of experience in dermatology after MD and I practice at Kolkata. I have served in the School of Tropical Medicine and Calcutta Medical College as teacher. Today we will talk about the basics of skin and common skin disease with management. Now, many of you may know that skin is the largest organ of the body. It is not the liver or muscle or bone. Skin is the largest organ of the body. Not only that, it is also an essential organ of the body. Without skin, you cannot live. The diseases of the skin are very common. In fact, they are one of the commonest ailments that affect us. Mostly at the time of calamities like flood, the earthquake, the incidence of skin diseases rise, but they are always very common. The most common skin disease have some similar symptoms like itching, some scaliness, so it is important to understand the differences between them. Therefore, it is crucial to be familiar with the treatments of several skin disorders, including dry skin, acne, psoriasis, fungal infection, and dermatitis like atopic dermatitis, seborrheic dermatitis, contact dermatitis, to name a few. People should work closely with a dermatologist, however, to diagnose and treat any skin disease to ensure that their lifestyle is not affected adversely. Treating them by yourself or through some non-dermatologist may jeopardize your lifestyle or quality of life. Now I shall discuss some of the more common skin diseases. Now, you can divide skin diseases into two broad types like chronic skin disease and acute skin disease. Let us see the chronic skin diseases. Some chronic skin diseases are lifelong, like some genetic diseases. They start at birth and continue lifelong. One of the most common genetic skin disease is called Ichthyosis vulgaris. This is nothing but some skin becomes fish skin-like and they become more common in winter. It is easily treated by applying some emollients, but they are not curable as they are genetic diseases. Then there are moles or melanocytic nevus, very, very common. Almost every person on earth has one or more of them. They are either black or skin colored, they are round or dome shaped, and haven't you wrote about your identification mark in any form? So the moles serve that purpose well. Moles also last for a lifetime. They have no symptom, but they should be regularly checked. Why? Because some moles become malignant. They are called malignant melanoma. This is a very difficult kind of cancer to treat. There is no good treatment for it, and it has a very high mortality even in advanced countries. Fortunately, malignant melanoma is very rare in India. Which are the warning signs that a common mole is going to be malignant. If there is any irregularity in the border or texture or color or shape, or it is increasing rapidly or bleeding, then you must go to the dermatologist for an immediate checkup. Now, patients with melanoma, which is very rare in India, about 1% of all the cancers, can be treated by surgery or chemotherapy or radiation, but the mortality rate is very high. Unlike moles, some chronic skin disease will not be present always, but will flare up from time to time. Let's see some of them. Seborrheic dermatitis. Now, all of you know about dandruff. This is nothing but a mild form of seborrheic dermatitis confined only to the scalp. The scalp itches and there is flecks of skin coming from it. But seborrheic dermatitis can occur in any other part of the body, mostly the T-zone of the face, then the front of the sternum, back of the sternum, etc. They are itchy and some reddish, swollen, greasy scales appear. It is a recurring disease, sometimes occur more in the summer months. They are easily treated by steroid creams. In babies, it is also common during the early 3 months of age. This is called cradle cap. Greasy and scaly patches of skin forms on the baby's skin, mostly on the scalp. It is harmless and usually goes on its own. Now next comes to psoriasis. Psoriasis is an autoimmune disease. It causes some patches, reddish patches, affecting any part of the skin, scalp or nails also affected. They are not very itchy. They occur more in the winter. There are many types of psoriasis, like plaque psoriasis, thickened plaque, then pustular psoriasis, which causes pustules, tiny pus-pointed vesicles on the skin. Then there is erythrodermic psoriasis, which causes almost all the skin of the body to be scaly and red. This is somewhat serious condition if not treated properly. Then invert psoriasis, it causes redness of the folds and slightly scaliness of the folds. Gutted psoriasis, very small red spots on the body. Psoriasis is a chronic condition and it usually gets bad in winter. We treat psoriasis by topical treatments as well as by medications that are given systemically. One of the most important medication is methotrexate, but this requires consultation with a dermatologist. Eczema is another very, very common skin disease. It occurs in infants and young children and also in adults. Symptom occurs rashes on any part of the body, mostly flexural though, like ankles, elbow, knees, neck, scalp. And there is itchy papules and vesicles, that is bumps and small fluid-filled vesicles. They are very, very itchy. They also causes dryness of the skin. Now there are also many different types of eczema and there is no known cure for eczema. We can make it in remission, but usually it relapses. Vitiligo. The white patches, in Bengali it is called sheti. Vitiligo is loss of pigmentation or death of melanocytes that produces the pigmentation in the skin. White patches, milky white patches in the skin are the main symptom of vitiligo. People with vitiligo often lose their hair color as well. Vitiligo is harmless condition. It does not cause any other symptom or sign of the body, but it is very harassing to the patient who develop it. It has a social stigma associated with it because many people think it as leprosy, a type of leprosy. It is not a type of leprosy. It is not contagious. It can be treated if detected earlier, except in one part, acrofacial type, which affects the tips of the fingers and toes and the lips. This type is resistant. Now let us come to temporary conditions that occurs and goes. Acne. Acne is one of the most widespread skin condition affecting the teenagers. Most of the teenagers get this in some part of the life. It is also called pimples. It occurs in many forms. Only papules, small whiteheads or blackheads, or pustule or nodule or even cyst. Now all types of acne are treated with creams, face wash and sometimes oral medications. Acne should be treated as early as possible, otherwise it will cause unsightly scars and pigmentation. They are difficult to treat. Now another very important and common skin disease is hives or urticaria. They are itchy lesions that are raised and they are evanescent, that is, they come and go. They are caused by allergic reaction in the body in response to some food or drug. Sometimes outside factors such as sunlight, cold, or even pressure from tight clothes can cause it. They are treated by antihistamines and preventive practices. Please consult your dermatologist for treatment because acute urticaria sometimes causes a complication like breathlessness that can be rapidly fatal. Come to wart, small raised bumps on the skin that are caused by human papilloma virus. Warts are contagious and can appear any part of the body. Common warts typically grow on hands, feet, and any part of the body. They often go away by their own, although that requires time. Unsightly warts can be treated by liquid nitrogen acids or electrosurgery. Fungal infections are also extremely common. Dharmatophytosis, they are called by various types of Dharmatophytes fungi, a condition in which the fungi lives in the most superficial part of the skin or nail or hairs. In the skin, they produces ringworm, round, scaly, itchy patches. In nails, the fungus buildup causes nails edges to crumble away, producing whitish, yellowish scaling and flaking on the surface of the nails. And in the scalp, they produces alopecia, particularly in young children. In foot, they causes athlete's foot. Now, mostly in the warm, damp climates, such as athlete's shoes worn for a number of times, prolonged periods can cause this athlete's foot. The skin between toes and under the foot may be saggy, white, cracked, or scaly. It often causes itch and causes soreness. The problem usually arises quickly. Treatment is usually antifungal cream and other oral antifungal treatment. Please consult your dermatologist for treatment. Nowadays, rampant use of cheap steroid cream without consulting dermatologist for decades have made the fungal infections very much resistant to treatment. Do not use any treatment without consulting your skin specialist. Maintain also proper hygiene. Candidiasis, called Haja in Bengali, is also very common. This is due to overgrowth of Candida albicans fungus on the body. It is a commensal fungus, that is, it resides in our body but sometimes produces disease. This causes irritated patches of the skin and found mostly in the finger and toe web spaces, armpits, groin, palms, and soles. Candidiasis can be usually prevented by home remedies, proper hygiene, and avoiding the overuse of antibiotic. Keeping the affected area dry is of utmost importance. Pityriasis versicolor is another extremely common fungal infection caused by Malassezia farfar fungus. It causes white, brown, or black patches on the skin, particularly at the time of rainy season. In Bengali, it is called chuli. It is treated by local and systemic antifungals. Chronic paronychia is another very common fungal infection. The proximal nail fold becomes swollen and red in this condition, usually caused by candida. Antifungals and avoidance of water contact helps. Now come to some viral infection. Cold sore is a red fluid-filled blister that is found near the mouth. The sore itself is painful. Other symptoms include itching or burning sensation on the side before the sore is visible. Cold sore are caused by herpes simplex virus, and there is no known cure of the virus. Once you are infected for lifelong. They reside inside the body. The sore may return and last up to 2 weeks. Medical treatment includes cream and medication. Please consult your dermatologist for treatment. If they occur more than 6 times in a year, we prescribe some suppressive treatment which causes its incidence to be less. Warts are another very common skin disease and everybody are aware with it. This causes raised bumps. This is caused by human papillomavirus. Warts are contagious and can appear in any type of body. Common warts usually grow on hands, feet, although they appear anywhere. They often go by their own, although unsightly warts should be treated by liquid nitrogen acid or electrosurgery. Some wart types are carcinogenic and therefore if a female is affected by them, they should be vaccinated to prevent the cervical cancer. Molluscum Contagiosum is another very common viral infection, particularly in the children. Small white round bumps appear which gradually becomes bigger and gets infected. Treated by acid application, microneedling and electrosurgery. Now comes to bacterial infection. They are also very, very common. They can be acute or chronic. Acute bacterial infection includes Impetigo contagiosa. They occur due to strepto or staphylococcal bacterial infection of the superficial skin, causing red, oozy, crusted lesions. Very contagious. Treated by local or oral antibiotic. Folliculitis. The same bacteria group causes infection of the hair follicles. They differ depending on the severity of involvement. It could be folliculitis limited to follicles only. It could be boil or furuncle involving adjacent areas of the hair follicles also. They could be carbuncle involving multiple follicles. They could be cellulitis involving cellular soft tissues. All of them need antibiotic for their treatment. Chronic bacterial infection. These are not very common nowadays. They include leprosy and tuberculosis. Leprosy was once very common, but nowadays they are somewhat uncommon. White or red anesthetic patches develop in the skin and thickening of nerves. Hair diseases are also managed by us. 3 most common forms of alopecia are alopecia areata. Hairs fall resulting in round smooth patches called in Bengali tak poka. They occur suddenly, treated by international and steroid injections. Telogen effluvium. Many hairs start falling at a time, causing panic. It occurs after 3 to 5 months following an operation, severe illness, childbirth, or crash dieting. Requires no treatment as all the hairs will grow eventually. Androgenetic alopecia or baldness affecting males much earlier nowadays and rarely females, treated by local and systemic medications for a long time. Sometimes it requires hair transplantation. There are many more skin diseases, but some of the most common ones are described here. Do not neglect them and never treat without consulting dermatologist. Stay safe, stay indoors as far as possible during this COVID-19 pandemic. Thank you for patient hearing.